Good afternoon on a beautiful day in the state of Washington. It's great to see you here in person again. You haven't aged a year since I've last seen you, somewhat less than that. So it's great to see everybody back here on a beautiful day. We've gathered here outside for a reason today. I want to talk about that reason, but before I do, I want to talk about set the stage of why we're here this afternoon when it comes to the COVID pandemic. We've had both huge success, huge diligence, huge frustrations, huge success, and now another huge challenge before us. And that is we have knocked down this virus already 3 times. But we have to knock it down a 4th time because unfortunately we are now experiencing significant growth in this virus in our beautiful state. That's hard to say on a sunny day, but it is the medical scientific truth and we have to face it. Cases have grown to over 1,000 a day. That's up from 700 a day in February. Daily hospitalizations last month were in the 30s. Now they're in the 40s. And these are all kinds of Washingtonians, not just those of age, but the younger folks are now becoming people who are now ending up in our hospitals across the state of Washington. So unfortunately, there is a strong evidence of a 4th wave potentially developing in the state of Washington. We cannot and we will not wait till that wave engulfs us. We have to prevent this from taking over the state of Washington. So there are some things we need to do today. Now here's the good news. We have understood the weapons against COVID and we have used them with considerable success. We know we've saved tens of thousands of lives in Washington state already. We have had the weapon of the mask. It's helped. We now have the weapon of the vaccine. It has helped. But today we want to ask Washingtonians to use a 3rd weapon against the fight against COVID. And that is, we are asking Washingtonians in the upcoming weeks to take it outside. Take whatever we're going to do when we're around other people and take it outside. Whether it's a coffee or a chance to see an old friend or whatever recreation we're going to have or whatever time we want to have just to goof off or even what business we want to get done. We want to ask Washingtonians to take it outside. And the reason is that this is a simple, cost-free, extremely healthy way to go about our business in the next several weeks. And frankly, it's imperative because these numbers are going to continue to go up unless something changes in our state. The status quo means the increase in COVID in our state, and that is unacceptable. So on a day today with the blossoms out and the daffodils going like crazy, and we're getting up to 70, it's a great day to take it outside. And that's what we're asking people to do. Now, this doesn't seem like rocket science, but it's frankly one of the things our Department of Health has thought about in the last few days. We've said, what can we do to break this cycle of increasing COVID? We've got the vaccine coming on like crazy. We now have about half of our adults in the state of Washington have received at least 1 dose. We've had tremendous success in our vaccine program. 32% of Washingtonians over the age 18 have already been fully vaccinated. And we know that anyone over 16 now is eligible. But this is something we can do, we should do, we really have to do to break the cycle of this increasing COVID infection rate in our state. And we know people can do it. And we know we can do it because we've done it before. Look, we have faced this same situation we are in today in the state of Washington 3 times already. And we have acted. Instead of being passive, instead of being fearful and afraid to change our ways, we acted. And because we acted as a state, we knocked down this virus 3 times. Now it's time to knock it down a 4th occasion. So taking it outside, together with the vaccine, we think could be a knockout punch for this COVID. And we hope people will do both. Get a vaccine. Today's Vax Day. Everybody's eligible over the age of 16. But while you're waiting for your vaccination, and unfortunately a lot of us are going to have to do it because we know we've got now about 6 million people eligible, and we're getting less than 400,000 doses a week. So we know that there's going to be waiting for this vaccine. But you don't have to be passive. You can do something today. Take it outside. Find a way to prevent this virus from jumping between you and your friend, or from your friend to you. We believe we will succeed if we do this. And I want to reiterate, we're just so close to success. This has been the longest year probably of most of our lives, and we are just this close to success. It really is the fourth quarter, and we've done such great work already together. Now we're asking people just to enjoy another great victory outside. So that's our central message today, and we're glad to be able to share it with you on such a beautiful day. Now, as far as getting the vaccine, again, we're extremely happy about the progress we're making. We know that we're going to continue that progress. I want to remind people of the accessibility of the vaccine locator.doh.wa.gov. The vaccine locator can help you. It doesn't mean everybody's going to get this vaccine right away, but it has proven to be a very useful tool for folks to make sure everybody does get vaccinated. Now, we are approaching a transition in our challenge in the state. The challenge heretofore has been getting enough supply of the dosages. We now have enough where we can make everybody eligible in the state of Washington. But we have another challenge coming on to us, and that is a hesitancy of some people to get this vaccine. And we are asking people, while you're taking it outside, also take it over to your parents' house, and your grandparents' house, and your uncles and your aunts, and your neighbors, and your kids, and remind them that getting vaccinated is imperative. It's imperative for their health, including young people who are now getting it in a more severe and frequent occasion. And it is shown to be an effective and safe vaccine. So we're very hopeful that people will be advocates with their loved ones to make sure that we get everybody vaccinated. We can do this along with our common sense measures. Now, this is an ongoing effort. We've had to, in three of our counties unfortunately went backwards on their metrics. They had more cases and they had more hospitalizations. And as a result, they've had to go in a different phase. And that's frustrating to people. But these are extraordinary times, and they require extraordinary measures still. We are not out of the woods. We just are not out of the woods, but we are at a position where we know we can do this. For the folks in these three counties, we know we can knock this virus down if we pull together. If we mask up, if we take the vaccine, if we take it outside, we're going to knock this thing down again. So I speak in confidence with these three counties, and I speak in confidence that other counties, if they join us, will continue progress in this regard. Legislative update. Very pleased about the progress that's being made. I think that we are very close to an extremely productive legislative session. And that's good to say, given that this has had to be remote. A lot of folks thought that it would be impossible to produce meaningful legislation this year. In the next week, we will possibly get over the goal line on homelessness issues, on police accountability issues, on a whole host of equity issues. Great progress is being made. I do want to mention one, though, that really is imperative to get done, and that is our bills to attack climate change. There are now two bills pending in the legislature that have moved forward in both chambers. That's the Climate Commitment Act, which puts a limit on carbon pollution, and the Clean Fuel Standard, which gives people better options for cleaner fuels. These things are so close to passage, and it is imperative to get work done this year on climate. So we're excited about the next week. It could portend really, really big progress for the state of Washington. And I want to congratulate the legislators who've done so much in this remote year. It's been great to see. With that, we have Lacy Fehrenbach and Nick Streuli are both here with me to answer any questions. You may fire when ready, Gridley.
Governor, you spoke of the 3 counties that'll be rolling back tomorrow. You did receive a letter late last week from a variety of groups across the state asking for you to hold off on that for 3 weeks. Given the lag in some of the data that's informing your decisions and the fact that vaccinations are moving forward at a pretty steady clip, why did you reject that request?
Well, we did it as we have throughout the last year based on science. And the science has told us that the virus is not waiting for us. I know we feel like we're done with the virus, but the virus is not done with us. And when I see these numbers every morning going up, it's extremely disconcerting. And they are going up quite rapidly. And so the virus doesn't just allow us to call a timeout. We don't get timeouts in this effort. And that's why we've had to act. And we've unfortunately seen some other states that have not taken this action that are now are seeing extreme problems in their hospitals and extreme surges. We do not want to get into that position. I heard one of the critics of this policy say, well, our hospitals aren't full today. Yeah, that's right. We don't want to get them full. We want to cut this thing off at its knees before we get into that position. It's too late to wait if we do not act in this position or at this moment, fundamentally because the science-demanded action now. The action we've taken has been quite measured. It has affected, fortunately, only 3 counties. It is rolled back. There are still businesses that are open. They've had reduced capacity. Is it I think, a well-calibrated policy to respond to this continued pandemic that we face? That's the best way to answer your question. I do want to tell people that this is not without a lot of thought. Listen, the concerns that folks sent to us in the letter, we feel those. Anytime you restrict a business, you don't do this cavalierly. We've thought deeply about this. We modified actually one of our situations which sent counties back only if they missed 2 of the metrics. But fundamentally, we're about saving lives in the state of Washington, fundamentally, and that's what we're doing. I will reiterate, the decisions we made have been criticized with some frequency, but they are saving lives in the state of Washington. We've saved over 17,000 lives because of the decisions we made that other states did not make. So we are continuing on that course. I think it's the right one.
Governor, you expressed some concerns about hesitancy, and so can you talk a bit about whether you have increased concerns that because of the pause of the J&J vaccine that will increase hesitancy among people in the state? And then California officials have said that they are going to reconvene that Western Scientific Review work group. Is Washington going to be part of that, and what do you hope to see from that?
Well, I assume we'll be part of that discussion to some degree. I can't tell you in what fashion. I haven't talked to Governor Newsom about that. But we will be very confident when we renew using the J&J vaccine. I think it's quite likely that we will. We'll make sure before we do that we're very confident about its safety. The situation is, yes, there is concern that this could cause increased hesitancy, but from what we know right now, I hope it will not. And there is good reason for it not to do this. And the reason is that this is a life-saving product. It reduces hospitalization deaths with a very, very high rate. And so far, we've seen out of just under 7 million doses, like 6 people who've had this event, which may or may not be tied to the vaccine. Now, to put that in context, that is less than a 1 in a million chance. An average American is more likely to get struck by lightning, literally, than to have a problem with this vaccine from the information we have today. And what we know in our daily lives is we have decided to take medicine that sometimes do have some potential side effects. Oral contraceptives are well known. They do have some, on occasion, side effects, which are much, 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 much more frequent than 1 in a million. But we've decided it's good for us in our individual behavior. So I believe in the ultimate analysis that we will see that these things are healthy, but we'll make sure that they are before this starts in every way that we can. I'm confident that the administration has taken a very cautious approach to this, and I'm very confident that we'll get the scientific right decisions. I may add that when we talked to the White House, what they explained is that one of the principal reasons for the pause was to simply make sure that physicians had the right therapy to give to these people if in the event you have these very, very rare events. So it was much about just having been able to give doctors the right info as it was looking at the particular vaccine.
Governor, I have two questions for Lacy.
Yeah.
She can't hear.
Yeah.
As the vaccine is becoming available to most adults now, what guidance is DOH giving for people who have been vaccinated in terms of whether they should wear masks and maintain social distance, and why would that be necessary? And then what sort of understanding should people have if they only have one dose of a 2-dose vaccine? How much protection does that give them?
Thanks for that question. I'm going to go in reverse order. So if you've only had 1 dose of a 2-dose vaccine, you're not yet fully protected. Your full protection comes 2 weeks after your 2nd dose in terms of evaluating your immune status and the efficacy of the vaccine. So fully vaccinated is 2 weeks after your 2nd dose for either the Pfizer or Moderna vaccine. And then for those people who have been vaccinated with the Johnson & Johnson vaccine, 2 weeks after their only dose. In terms of your question about masks, the CDC, Department of Health, and State of Washington still recommend wearing masks anytime you're in public spaces, indoors or outdoors, around other people. If you are fully vaccinated and you're doing a small gathering at a private residence, and you can, in that case, not wear a mask. This is because we're still learning about the virus, immunity, and still, as you heard from the governor, in a very dangerous dangerous situation in our state with regards to transmission of disease in communities across Washington.
If I can add something on the masking when you're outside, even if you're fully vaccinated, I'm hoping people can mask up when they're in public, in part because it sets a cultural sort of acceptance of this. It encourages other people to be careful in their health, and that's helpful. So all of us can be a leader right now in this continued effort. Why don't we just kind of go around the horn here?
Where do you think, help us peer around the corner, and as you see the vaccination numbers going up, and you see at the same time the case rates rising, but generally, do you think we need to get to 50% vaccinated where you could then start to back off more and reopen things more? Do you think we need to get to herd immunity, which might not happen because of vaccine hesitancy?
Well, I wish I had an answer to this question, but the science does not exist on this. We have given consideration of building into our metrics a percentage of vaccinations, as you would suggest, might make sense. The problem with this, though, is we really don't have a scientific algorithm to show where the percentage of vaccine reduces the R0 number of the rate of infection. We just really don't, science does not really have an insight on that at the moment. So I don't think the answer scientifically exists to allow us to take that position. Now we're hoping, this is not a certainty, but we're hoping there is a point where it does that. We just don't know where that is. We don't know there's a certainty that it is either. It's one of the reasons taking it outside, wearing a mask, remains very, very important in this fight. So I think to some degree, because the vaccines are so successful, we just can't allow it to blind ourselves, to use this other weapon that we know that works. And that's why we're here today to talk about that.
You mentioned your critic, Senator Braun, said that with the most at risk, there's a pretty high vaccine rate now with the most at risk for death. He doesn't think that the case count is the right metric anymore, and that if you focused on hospitalization and death rates and not case counts, that would be more appropriate at this point. What's your response to that?
Well, I think, listen, there's arguments about all these things, and none of this is written in the tablets that came down from the mount. So I listen to suggestions in this regard. But the problem is that we now have young people coming into the hospitals too. It is not just older people, and some of these younger people are having some very significant long-term impacts besides death of older people. That's one of the reasons we need to continue to look at the case numbers as well as the hospitalization, because we know there's a connection between the two. Case numbers go up, then hospitalizations go up. That's number one. Number two, we have to realize that we still have 25% of our seniors over the age of 65 who are not vaccinated. They have a target on their back. They are in the danger zone. And those people still count in our community. and we got to care about them. And I doubt we're ever going to get to 100% vaccination rate in that community. So it is important for all of us to pitch in here in that regard, both to get older folks vaccinated, but also to try to knock down the rate of the infection so that those people's lives are not threatened. To me, that makes sense. So we think this is the most scientifically credible two metrics that work together in this regard.
Go ahead.
Yeah. This might be for Lacy, it might be for the governor. The reopening right now, if a county has just slid backward, it took missing both metrics, but to get back to where they were, it takes, I think, making both again. Is there any thought to maybe making it so they could make just one metric and move back up in a phase?
Not at the moment. We can go around here.
Where are the counties that you're seeing a concern, some of these spike in these cases at the present? And if that's the case, considering all other aspects, would you review the 3-week review to require that when you look at those current metrics on when to decide to reverse those phased reopenings or not?
Yeah. Well, the 3 counties were the ones that, obviously had 2 difficulties in 2 of the metrics. There are a variety of other counties, well, many counties where this is going up, where these numbers are going up. So it's not just these 3. I'll get you I will send to you a specific list of those counties, but it is several. It is not just these 3, and that does give us a concern. These are not the only 3 counties where these numbers are going up. So that is a concern. The issue about the period within which we look, we thought 3 weeks was the best mix between responding to current conditions and giving people predictability. Those 2 things are always in contest, right? People would like to know what the rules are for the next 6 months. It makes their lives easier, but then you're not responding to current conditions. We just thought 3 weeks was the best way to respond to both. Yeah.
Governor, considering the numbers that you pointed to, the numbers that you were seeing, you've been talking about potential 4th wave for a couple of weeks now. You're still seeing the numbers go up. How fearful are you that you're going to have to initiate further rollbacks when the time comes in a few weeks?
Well, the word fear, I try to avoid it because I don't think it's productive. I am concerned, but I'm not fearful. And the reason is that we Washingtonians know how to beat this virus. We have knocked it down 3 times. We know what we have to do. We've demonstrated a willingness to do that. So I don't think we should approach this with fear because we have the tools to be able to beat this monster. And so I don't look at it for fear. I look at it with confidence that we can do this. And we've got this beautiful state today that realizes if we take stuff outdoors, we'll be even more successful in that regard. So I approach this with confidence that I think we will succeed on this, but we just got to remain diligent and use the outdoors right now.
Can I ask about this one
Sure.
legislative matter?
Yeah.
There have been many police reform bills. I don't think you've had a chance to sign many of them yet. But would you just talk about the sort of significant change you see coming when that police reform legislation all takes effect?
Well, I think I'm looking forward to real successes on this because I think the legislature has been both active and thoughtful on approaching this on a variety of issues. As you know, the independent investigation I considered very important. That's why I've championed that in the legislature. I think we're going to have a good product in that regard. Some of the accountabilities professionally I think make sense. I thought they made sense even before some of the recent tragedies. And they've approached this on a comprehensive basis, not just one and done kind of approach. So I feel good about where we are in these bills, and I appreciate legislative work on them. It has not been easy.
I have a question just with the first day of it being opened up to everybody for a vaccination. There's still a lot of people that it's a confusing process for. They're, and especially in those dense urban areas, they can't find an appointment. Is there something more that can be done to kind of smooth the process? I mean, should those people be looking in rural areas? Is it okay for them to be looking anywhere and everywhere they can get a vaccine? And what do you say to those people who are trying and still can't find a spot to get a shot that really want it?
Well, what I will say is we want to move as fast as humanly possible to get everybody a vaccination, and we are doing exactly that. We now are well over our goal of 45,000 vaccinations a day. Lacy, what number are we at now? 70? 62. So our goal was to be able to give Washingtonians 45,000 doses a day. We're doing 62,000 doses a day. Help is on the way. What I would say is we get that this is a time where patience is necessary, and that's the most difficult thing in the world. But again, I want to reiterate, frustration isn't enough. Be careful. Go outside. Wear a mask. These are things that we have the capability of protecting ourselves, waiting for that life ring to get here. It's coming here. So protect yourself while you're waiting. That's number one. Number two, there are things we are doing to improve the ease of getting this. One example, we've extended the hours of our max vaccination sites. So as you know, we've got 5 max vaccination sites, state and federal. We are extending the hours into the evening and weekends so that working people don't have to take off time for work. That's a good thing. We are increasing the use of the telephone access so you don't have to have a computer. So now to make an appointment, if you don't have access to a computer, we are reserving a percentage of these slots for people to use a telephone. We are increasing the use of walk-in clinics. So you can just walk in. You don't have to have an appointment. I was in one at a Hispanic shopping center in Yakima, watching people just walk in. We are increasing our taking vaccines to the people where they are, including their work sites. So we are sending out mobile teams to large employers to vaccinate people right on the job. I went to one of the first ones in Chelan Fruit in the Chelan area. I was pleased. I was in Spokane the other day and saw not only the Max Vax site, but I went to a pop-up clinic and there was a bus and it had folks that looked like they were ag workers, and I just went up and said, hey, can we get these folks to go over to the clinic and get vaccinated? And I talked to the driver and he said, well, we could, but all these guys just got vaccinated yesterday at the Green Acres farm. So we are increasing our efforts to get to people who have limitations, but I know there's always more we can do. We're also increasing our ability to provide information to people. We're now in 32 languages. We are doubling our budget. We're doing it in multiple languages. We're adding channels in the Spanish language channels. I met with people in Yakima about this last week. So those efforts are continuing.
Governor, with a fourth wave, as you mentioned, can you explain your decision last week to kind of loosen those reopening guidelines and make it so that you only have to meet one metric, and why not, I guess, with this fourth wave potentially, why not move the whole state back a phase for a month to let vaccinations kind of catch up?
In answer to your second question, it is because there was enough disparity between our communities that we thought it wasn't appropriate to have a one-size-fits-all. There was enough disparity to make sense to have a county-by-county approach. To answer your first question, this is something we've actually thought about on every single day to some degree. And the more we looked at the data, the more we saw that the case rate and the hospitalizations worked together, and it made sense to look at both rather than singularly. Because if you looked at them just singularly, you might have got an aberrant response. Either way, if you had a county that wasn't doing many tests, so there wasn't many positives, but they had a large hospitalization, it may not capture the problem, or vice versa, if you do too many tests. So we just thought those two things worked best together.
Your two bills, as you say, are moving forward. As you know, at this stage, both bills contain language that link them to some sort of transportation package. I'd be interested in knowing first, why did you agree to that kind of linkage that would hold up one? And second, is it important enough, are you prepared to call them into special session, make sure it gets done? I mean, there's a lot of work on all three at this point.
Well, I haven't agreed to have a linkage to any other matter. I don't think those are necessary, so I have not agreed to those things. I do believe that it is morally, economically, environmentally, and health-wise necessary to take major action against the scourge of climate change this year by the legislature, and I'm intent on seeing to make sure that that gets done.
I have a legislative question as well.
Yeah.
You might have heard the Republicans are calling for action on executive powers. At this point, do you feel that the legislators should have more of a voice in these sort of proclamations and such going forward?
Well, the legislators do have a voice. They have the ability to pass legislation. So they are involved in this today. They're in session. They have the ability to introduce bills, and I'm not keeping them from introducing bills. In other words, the legislative is in session. They do have a voice. They get votes. They get motions. They get amendments. So they have that ability today to be engaged in this. I would point out that I don't think it's necessary to restrain executive authority, in part because we've had now dozens of challenges against the use of our executive authority to save lives. Every single one of those has resulted in a ruling in favor of the governor. Every single one. They have not won one case to show that we have violated the law in the use of our emergency powers. I think that's both gratifying and maybe worth considering if people want to, gut the ability of the governor to try to save lives. So no, I don't think that that's necessary to do. And again, I do want to come back to this. I'm sorry if the people in the press have heard this before, but what we're doing is not some kind of sophistry or rhetorical exercise. It's about whether people live or die. And as I've said, there's 17,000 people who are alive today who would not have been alive in the state of Washington if we had the same death rate as some other states. And so these things that we have done have had an impact of actually saving people's lives. And I think that's a good thing. So attacking a good thing, I wouldn't agree to.
I think Promo TV, you guys haven't gone yet, right? Go ahead.
Yes. Thanks for your time, Governor. My question was, a lot more counties would be rolling back to phase 2 tomorrow if the metrics hadn't been adjusted, but numbers of cases are starting to creep up. Like I was checking the numbers for King County, and we're creeping up to 198 cases per 100,000 people. What's your message to those counties, in light of us heading into this fourth wave in the context of why we're here today?
My message is take it outside. Just take it outside. Have your meeting outside because it is so much safer to be outside. Look, the only way the virus can infect people is if we help it. And it is much easier for that virus to travel indoors than outside. So my message would be take it outside, keep your county open, save yourself, enjoy the outside. We know we can sit outside and have a cup of coffee in today's environment, or dinner, or a walk, or anything else. We know we can do these things. So they're very available to us, and that is my fundamental message today. If we do this, again, I'm very confident that we're going to do well.
Asking about the Blake decision. Last week when I asked you, would give it a limited response saying you just wanted to help the legislature reach a conclusion, and I think they could use your help right now in that the House, a majority wants to legalize a certain amount of personal use. The Senate majority appears to not want to do that. As the third person who would have to sign the bill, do you support allowing people to have some amount of drugs for personal use, have it legal?
So I have been cautious about drawing lines in the sand on this bill because I do believe this is something that's complex. The legislators need to work with each other. I am helping them. I had a discussion this morning with both leadership about the Blake decision. I do believe that there's a broad-scale effort or interest in increasing looking at the drug issue as a health issue more than we have, as opposed to a criminal enforcement issue to some degree. But there is also an interest to having some mechanism to encourage people to be involved in therapy to solve chemical addiction problems. And I think the legislature is going to have to figure out the balance between those two things. And I'll continue to help them to the extent I can.
From Cairo Radio. First, due to the Pierce County rolling back to phase 2 tomorrow, a couple has had to disinvite dozens of guests for their wedding, as capacity will be reduced. In the past, you've allowed flexibility for events like this and similar rollbacks. Do you consider doing anything like this time? And then second, How does rolling a single county back to phase 2 stop the virus from spreading if people from that county are still traveling around the state for spring break, tourism, and the nice weather, and to get vaccines in eastern Washington?
Well, listen, when you roll back a county, you have an impact on 1 million people. That's significant. This has been a significant step. This will reduce the interactions where the COVID virus can jump from one person to another for 1 million people. That is a lot of people that we believe that we can potentially save their lives by taking this step. It's not an insignificant number of people that we are impacting. Yes, whether people walk across the street to a different county, you bet. But what we have found is that when we take these actions, we reduce infections and we save lives. And that's why we've taken this action. The wedding issue, look, it's hard. These are frustrations. I hope the couple will have a great wedding. I hope they have a future where they can all celebrate as much as they can, and I wish them well. I hope they have half as much luck in marriage as I have had. Anything else?
When's the last time you had a press conference this size, and what's the significance?
I don't know. Maybe when was it? Anybody know? A year ago, 9 months ago. It's good. It's
As if this is being used as an example. I don't think it's really going to see this.
well, it is an example because I feel very safe in this environment. We're outside where there is a dramatically reduced rate of infection. We're wearing masks, and I feel very safe in this environment. It would be less so if we were inside, kind of more shoulder to shoulder, right? Even though I've been doubly vaccinated. And again, even though I've been doubly vaccinated, it still makes sense to be careful around people. So I'm really happy to see you again. I'll look forward to our next outside conference. Anything else? Closing? 1, 2, 3. Yeah.
Said a few minutes ago about the climate change. Your original cap and trade bill did include language that would allow some money to go different places, including transportation. The current version specifically has amounts for transportation of all sorts. Are you saying you oppose that specificity? And if so, what would you like to see instead?
I don't think it's necessary to limit the application of either of the climate bills depending on what expenditure is made from a particular source for transportation. There is no logical reason to do that except to intrude on the ability to protect people from pollution. So I don't favor that approach. But today that's being worked on. There are quite another avenues to solve this problem. And I can report to you that there are an increasing number of legislators that are coming to focus on these two bills and be in favor of them. I've been very encouraged in conversations the last few days with members who, as they've come down to the end of the session, are now understanding it's time to put up action, and they're willing to do it. I'm very pleased about where these bills are right now. Thank you very much. Be well. Go Mariners.